Dentine pins, what would you recommend for restoration on molars where composites have failed? First question to ask yourself, if it's basically, is it restorable, first of all? Now, I don't use pins or posts on molars. What I've done for well over a decade now is just the NIR core technique. And the NIR core technique can be used for an amalgam, and it can also be used with heated composite as well, but you've got to have really good moisture control. So to retain, to basically retain that restoration, use a NIR core, either composite or amalgam, or think about something like an endo crown where you're using the access cavity and the very tops of the canal orifices to retain that restoration. Other ways of helping, maybe use the electrosurge to gain more ferrule around the tooth. So look at all of those options, but always be a little bit honest. Do you think the tooth is restorable? Because sometimes these teeth are just so lacking in coronal structure, they're not restorable. What's not restorable? Anything really with less than about 20% coronal structure is basically very dodgy, okay, very dodgy.